As athletic trainers, you know that sudden cardiac arrest, or SCA, is a life-threatening emergency that occurs when the heart suddenly stops beating. When SCA happens, the person stops breathing. They may gasp or shake as if having a seizure, but their heart has stopped, which means they will die if they don't get help right away. And as athletic trainers, you're always prepared to respond. But given the survival rate for SCA has remained at 10% for the last 3 decades, what else can you be doing to protect your sports community? You likely know that SCA is the #1 killer of student athletes and the leading cause of death on school campuses. But did you know that 1 in 300 youth has an undetected heart condition that puts them at risk? This training takes a deeper dive into how you can create a culture of prevention in your sports program by elevating your sudden cardiac arrest prevention protocol. For example, did you know that up to 72% of youth stricken experienced at least one symptom prior to the event? Sometimes days, weeks, or even months before. It just wasn't recognized as life-threatening. So let's start by reviewing warning signs and risk factors for sudden cardiac arrest. Because many of these symptoms do occur in a healthy population, they can be easy to miss. But given the majority of stricken experienced them, it's worth taking a second look. Fainting, while often attributed to heat, dehydration, or low blood sugar, is also the #1 warning sign of a potential heart condition. Sometimes dizziness or lightheadedness is a precursor to fainting. While not always cardiac-related, fainting that includes a sudden collapse without warning, and especially during exercise or exertion, needs follow-up. Student athletes who faint should be referred to an MD, DO, or licensed medical practitioner specializing in cardiac examination to be evaluated for a potential heart condition. Typically, diagnostic testing like an ECG or echo are part of a comprehensive cardiac assessment. Be aware that in some states, it's the law to remove student athletes from play if they faint or exhibit other symptoms that appear to be cardiovascular related. Student athletes must be evaluated by a medical practitioner as defined by state law and cleared to play. Likewise, chest pain and heart palpitations, which can feel like a racing heart or irregular heartbeat, are especially concerning when they occur together or individually with exertion and are accompanied by fainting or decreased endurance. Additional symptoms include excessive shortness of breath and unexpected fatigue during or after exercise. Any of these conditions that appear severe or chronic could also be of concern. As student athletes participate in athletic activity and train regularly, their body should be getting stronger. If they continue to struggle, it makes sense to report that to a parent or guardian for follow-up with an MD, DO, or medical practitioner specializing in cardiac evaluation. Heart conditions can be inherited, so a family history of heart abnormalities, sudden cardiac arrest, or unexplained fainting, seizures, drowning, or near drowning can put student athletes at risk. That's why thoughtfully completing health history forms is important. You may encounter families with multiple siblings who participate in sports. Keep in mind that all members should be tested when one experiences any of the warning signs. It's also important to let student athletes know that the use of illegal drugs or misuse of prescription drugs and inhalants, plus the consumption of energy drinks, diet pills, or performance-enhancing supplements can compromise their heart. An important question is, why don't student athletes report warning signs? The reality is that we live in a very competitive world, and youth are encouraged daily to rise to the challenge. Student athletes often don't tell adults if they experience symptoms, and adults often urge them to play hard. Young athletes, and often their parents, don't want to jeopardize their playing time, so they may avoid telling adults in hopes that the symptoms will just go away. Student athletes may be embarrassed they can't keep up, thinking they're out of shape and just need to train harder. Some training programs penalize a team when one person can't keep up, and kids don't want to be that one person. What's more, if student athletes have felt these symptoms all their life, for example, their chest always hurts during exercise, they're often unaware that what they're feeling is not normal. Or they've spoken up but have been told it's something else, such as asthma or anxiety. So they think the issue has already been addressed when it still persists and may need to be reevaluated. But the biggest contributor to why student athletes don't speak up is because nobody asks them how they feel or specifically if they've experienced any of the previously mentioned warning signs. What can you do as an athletic trainer to create a culture of prevention in your sports program? Be familiar with warning signs that occur or reoccur in your student athletes and educate all coaches, athletic directors, and parents or guardians. If symptoms or an SCA event occurs, document the incident to assist a medical evaluation. Before each season, educate parents, athletes, coaches, and athletic directors about SCA in youth, team protocol, league policies, and state law to prevent any obstacles to you addressing incidents when they occur. Urge sports clearance packets to be completed thoughtfully. No one should just check the box year after year. Forms should be reviewed by parents and student athletes together each season, so youth are part of the discussion about symptoms they may have experienced and never mentioned. Heart conditions can develop as you grow, so clearance should never be a one-and-done effort. Team meetings are the perfect time to educate everyone about warning signs and risk factors as sports clearance forms are processed. Discuss why student athletes would be pulled from practice or play in advance to limit pushback from parents in the moment. If mandated, enforce state law to remove from play student athletes who pass out or faint or have suspected cardiac-related symptoms that require a written clearance to return to play from a licensed medical practitioner. Most importantly, encourage student athletes to report any symptoms they experience and for players to be supportive of each other if they notice symptoms in their teammates. As you train with them, take the opportunity to check in on how they're feeling. And especially if they mention symptoms, tell them how important it is to get checked out by a medical practitioner. The second part of this training focuses on how you can prepare your teams to respond to a cardiac emergency. The first and most important thing you can teach your teams is that a sudden cardiac arrest victim will likely die if nothing happens after 911 is called. Seconds literally count, so student athletes, coaches, and parents must understand that CPR must be started immediately. And if you have an AED, it must be retrieved simultaneously. Remind your team that CPR for sudden cardiac arrest victims consists of hands-only compressions, hard and fast in the center of the chest, about 100 compressions per minute. No breaths are necessary. Do they need more motivation? How about that CPR can triple a person's chance of survival? Or that an AED shock delivered in the first minute can increase the survival rate to 90%? And most importantly, no one needs to be certified to perform hands-only CPR or use an AED. Both are intended for bystanders to use because a heart can't be stopped for more than a few minutes, and the average arrival time for EMS is 6 to 13 minutes. Preparing your team to take quick action will mean the difference between life and death. Let's talk about more ways you can create a culture of prevention in your sports program. Have a written and well-practiced cardiac emergency response plan that involves administrators, coaches, sports officials, parents, and student athletes. And by practice, we do mean drill. Fire drills are a safety standard, although a fraction of people are lost to fires compared to SCA. We should be doing similar drills to prepare for a cardiac emergency. Personalize your plan to each athletic venue. Plan should note availability of cell coverage to place 911 calls, available AEDs, road or field access for ambulances, and actual locations that vary from street addresses programmed into EMS navigation systems. Review the plan each season at staff, parent, and team meetings. Everyone on campus can play a role in saving a life. Have an accessible AED. The recommended standard is that an AED should be retrieved and ready to use within 3 minutes of collapse. If there's not an accessible AED at your facility or field, consider purchasing a mobile unit you can have at all practices and games. Fundraisers, as well as designating a portion of team fees, can supplement the cost. Sports programs should also recognize that failure to have proper emergency protocols in place can put the program at significant risk of legal action if a cardiac emergency occurs and an appropriate response was not initiated. While advising that a student athlete should miss a game to get evaluated and cleared to play, or enacting additional safety protocol across your campus may seem inconvenient, it would be a tragedy to lose a young person because warning signs were missed or because sports communities were not prepared to respond to a cardiac emergency. Let's work together to keep their heart in the game. For more information, visit keeptheirheartinthegame.org.